this. The last session we tried to record, but we didn't get a good recording, so we were unable to post the information on the website. We are recording this session, and we're hoping to get a good recording so that we can put the link on the website along with the PowerPoint presentation. This presentation is going to be the same as the first presentation. I do have a little more information for case managers and case manager supervisors with regards to how Adidas is going to look and how you need to go about the business flow. But the initial information regarding the changes to the criticality will be the same. This shouldn't take more than an hour. Again, this is going to be a lecture-style webinar, so I'll be presenting the information. You'll be able to see the PowerPoint on your end, but we won't interact, and you won't be able to ask me questions directly. If you do have questions, please feel free to to contact your waiting list coordinator. If they can't answer a question, then they certainly will send them to me, and I'll try and get a response. But I think that based on the first webinar, that a lot of people have already asked questions and had responses back from the waiting list coordinators, and everybody's just anticipating the change. So I'm going to go ahead and move forward with the presentation. From time to time, I'm going to put my phone on mute to take a sip of water, and I don't want you to think that you got disconnected. Okay, I'm trying to, let's see, move my, I'm sorry, I have two screens going on. I was trying to move my PowerPoint presentation. The history of the update to the criticality is about at least 3 years, if not more, in the making. We have had numerous requests from all over the state, case managers and case manager supervisors, to update or change the criticality because it didn't meet our needs. The biggest change to the criticality has been in the high risk and the family support categories. And what we did with the high risk category is we are trying to align our business process and with our waiting list process and making sure that the criticality matches both of those. And what I mean by that is that in the high-risk category, we want to expand the reasons why a person would need or fit the definition and need emergency services, such as residential habilitation. So rather than the only way to show high-risk need is that of being homeless, we have expanded the reasons why a person would fall in the high-risk category. So category 1, and I'm going to read this for you. The definition: the service or support is required to ensure the safety of the person or of others. Not providing the service or support will place the person or others at risk of injury, abuse, or serious harm. This has changed significantly, so you'll want to pay attention to the changes. The first thing that the criticality is going to ask you to do is to tell if the person meets this definition. It wants you to indicate whether or not the situation has already materialized. That means it's already happened. Or if it's imminent, which means within 30 days this is going to happen. The next section is going to ask you to indicate why this person meets the definition of high risk. And the selection that you have is the person's only caretaker has died or is incapacitated or no other is available, or family caretaker no longer able to provide care, placing the person's health, safety at risk. This includes abandonment. Person, for whatever reason, currently has no residence. We're familiar with that, homeless. Person is at imminent clear risk of abuse or neglect. person is at imminent clear risk of seriously harming self or others. When you look at the criticality assessment itself, you're going to have drop-downs. So where this looks like it's a checkbox, you're going to have a drop-down, and it's going to ask you to indicate the risk, whether it's materialized or it's 30 days. So you only get to select one of those. And the same is true for the type of risk. It's a drop-down. You'll only need to select one, the most appropriate, that meets the definition. Just like the current criticality, we're going to ask that you fill out the medical and behavioral support checklist. And then you'll see a big change down at the bottom, and that's with the service group. You'll see that you no longer have the ability to mark dehabilitation in the high-risk category. This is intentional. The intent or the idea, again, is to make sure that all of our processes are in line, the waiting list process, the reserved categories for emergencies, and the criticality assessment. Our view of an emergency is similar to the definition that you see here, the reasons that the person meets a high-risk category, and they would also meet the reserve definition in the waiver for emergency placement, which is residential habilitation. So you will not see dehabilitation in high-risk category. You do, though, have supports that also could be in place. The next category is family supports. Definition: the service support is necessary to help the family care for their family member in their home, or the service of support is necessary to support the individual in the home because the family support is not available. The intent of the service is to prevent the need for the individual to enter a residential setting. So right there you'll see that we are trying to prevent residential habilitation placement in the family support category. These, the next section is going to ask you to check if the person meets the definition. That hasn't changed from what you're already doing. And it also asks you to indicate why the person meets the definition. Now this, you're allowed to select more than one reason. So this is going to be a checkbox in your criticality assessment. This hasn't changed. The next section, we're going to ask for you to fill out the medical and behavioral checklist. And in the next section, you'll see another big change with a note. The service groups needed for this definition are day and supports. And the note you'll see is that residential is no longer applicable to family supports. And I think that I think that it's pretty straightforward with the definition, that the idea here is that we're trying to prevent residential placement. So we're providing day supports and other wraparound supports in the family home or in the person's home to prevent the more strict residential habilitation placement. So you will not have residential habilitation here, and that is going to be a change. So with the two categories, the high-risk category and the family support category, if you have someone marked in these particular categories, when we do the conversion, none of that data is going to be automatically populated in your criticality assessment. We'll want you to re-look at the information. You may have to contact the person to make sure that you're putting the person in the right category, especially if you've had someone, for instance, in Category 1 that's in day hab service, in Category 1 that's no longer allowable, or in Category 2, family supports, if you have someone in residential. Those are going to be big changes, and we'll need some documentation around high risk, and we'll talk about that later. Moving on to the next category, individual daily living supports. The definition: the service support is necessary to help the person perform activities of daily living or to help the person in living independently or developing the skills needed to live more independently. Not a lot has changed in this particular category. There's a couple changes. I want to point those out. This is another category that if you had any information in this particular category, it's not going to be automatically populated because we do need for you to look at this category because there has been some changes. Again, you're going to check whether or not the person meets the definition. The second section, you'll see check if the person is at risk of moving to a more strict restrictive setting, i.e. residential habilitation. And then the next thing that you'll see on the assessment are those two indicators. You'll see them in a drop-down box, so you can only select one, and that is the risk of moving is imminent, immediate, which is 30 days, within 30 days, or that the risk is likely within a year. Okay, and then the second thing that you'll see is a note, and that note indicates that if the likelihood of the more restrictive program, such as residential, is likely more than 1 year but less than 5, then we want you to go to Category 5. Something new is the addition to the indicator of whether the person is going to graduate within a year. And if so, we need for you to indicate that. Also, if it's beyond a year but less than 5, we want you to go to Category 5, which is the long-term planning. Another change is that this category is going to ask for you to fill out the medical and behavioral checklist. That's different. And then you'll see this looks more normal, where you have the selection of service groups, residential, day, and supports. Category 4, inclusion supports, definitions. Service support is required to address barriers that might keep the person from participating in meaningful community activities. This has been, I believe, truncated. I get this in Category 5 a little confused, but basically if the person meets this definition, all you have to do is mark the one indicator, and then in the second section, the service group, note what services are needed. If you have information in this particular category or Category 5, the information is going to be automatically populated for you. So you wouldn't necessarily have to go in if you had someone strictly set up for inclusion or long-term planning. You wouldn't have to go in and reevaluate that record necessarily, but you still have to go through the workflow, and we'll talk about that in a minute. Category 5, long-term planning. Check if the family has long-term planning needs, such as knowing that they will want residential placement sometime in the future, longer than a year but no longer than 5, and then children cannot be considered in this category until they're 14 years old. And I think this is the category that we truncated, and we put, there was a few indicators in this, and we pretty much put them all into one indicator. Again, if you have marked this in your current completed criticality assessment, it's going to be automatically populated in the new assessment, and you're going to indicate which service group, residential, day, or supports. So Category 4 and Category 5 did not change a lot. Category 4 may not have changed at all. Nothing new here. The medical and behavioral support checklist, nothing's changed here. The only thing that's changed really is that we want you to complete the medical and behavioral checklist for Category 3. That's the only change. Okay, another new step or requirement is the high-risk assessment supporting documentation. And you may all already be doing a version of this, but what we really need now is for us to be able to document the need for the high-risk criticality determination. What we want you to do is to get all the backup documentation to support that need, the emergency placement need, the high risk, and upload it into Adidas, attach it as a note. And that's for everybody. And I have to say, I know that a lot of regions or some regions may not use notes like other regions do. If there's any kind of training issues around how to use the notes, then you can get up with your regional office, and we'll talk about having a refresher on how to use the system. But it was the request of the directors that we have this documentation uploaded and attached into Adidas. So if you have someone that you're placing in the high-risk category, then we'll need this kind of information, and I'll read through it with you. And if you have questions, certainly get up with your regional office directors. They'll know what kind of documentation they'll accept and what's not acceptable. The person's only caregiver has died or is incapacitated or no other is available. We're looking for a physician statement, obituary, it's a little morbid, but obituary, a note from case manager indicating previous evidence in either Adidas or note or social history. Family caregiver no longer able to provide care, placing person's health or health and safety at risk. Physician statement will be accepted. Statements from caregiver detailing reasons for inability to provide further care. Statement from case manager or other providers detailing why care cannot be provided. And this again is we're looking at issues of abandonment, but there are others. Person for whatever other reason currently has no residence, and this is homelessness. Eviction notice, foreclosure notice, DHR report of Adult Protective Services intervention, detailed statement from significant other who can provide supportable evidence. The next one is person is at imminent clear risk of abuse or neglect. We'd be looking for police reports, physician statements on injuries, hospital reports, DHR reports, special incident reports to the regional office. Person is at imminent clear risk of seriously harming self or others. Again, we'd be looking for police reports, incident reports, progress reports, hospital reports, or CMHC reports, reports of observation by verifiable sources, caseworker, case manager. All supporting documentation must be scanned into Adidas with a note to the Regional Community Office Waitlist Coordinator. Without adequate documentation, a person's waitlist record will not be approved. This is really important, and this is a change in the business process, I'm sure, for a lot of people, if not everyone, that before a waiting list coordinator will approve a high-risk category criticality, we need this documentation in Adidas. So this documentation will be required when you move forward with the process of completing these revised criticalities. If you have someone you feel that meets that definition, we will expect this documentation to be uploaded and attached into Adidas. We did have some questions from case managers. What can you do in advance? What can we be working on? This is one of the things that you could really be working on, is making sure that you have this kind of documentation available to attach to a person's record if you're completing a high-risk category. Now I want to get into the way that the business flow is going to work for the case managers and case manager supervisors in Adidas. We all, pretty much everybody should know how Adidas works, and that the first place that you start is with the Programs tab, with the CM Action that launches your workflow wizard. we will bypass that process. Because Harmony is going to automatically create almost shell-like criticalities, and they're going to set them all to pending, we're going to bypass that Programs tab and that step for the case manager and for the case manager supervisor. This is the only time I'm going to suggest or tell anyone to bypass that Programs tab. What Harmony will do is create a criticality assessments based on the new criticality form, and they will automatically populate some information. Some information will not be populated, and the case manager is going to be required to go in and do some manual intervention. Sorry, folks. The screen that you're seeing right now is what you'd see if you went to your Assessments tab. Case managers, I think that it's important for you to know who all you have on the waiting list that's ranked right now. I know that some case management agencies have waiting list coordinators. It may be easier for those folks to know who all they have on the waiting list. But if you can get a list of your waiting list records, if you can't access that, we'll work with the regional office on getting you some sort of report, but you're not going to know really all the records that need to be updated in any kind of easy way. So we'll need to get information to you if you can't get it on your own. Bear in mind this is over 6,000 records, or actually over 3,000 records at the state level. If you don't have a way to know who your waiting list clients are, we'll try and work with you. But there's no way other than knowing you need to update this list. There's no way to get that information to you. You're going to be bypassing programs and going straight to assessments, to the assessments that you want to update and re-rank for the waiting list. What you'll see is all of your assessments, and you'll see a Criticality Summary 2013 with the status of pending. This is the assessment that you're going to access and you're going to update as a case manager. The previous criticality assessment should be available for view only, but as we move forward, when you do a copy from previous, you'll want to copy from previous this new assessment and not the old criticality assessment. In fact, I'm not sure that you would be able to copy from previous from the old criticality assessment. But we do want you to have the ability to look at the old criticality assessment, and it will be necessary that you look at that probably because you might not or probably won't know what services have been asked for without looking at your previous criticality assessment. I went in and did a little bit of testing on this just to see how the workflow would go, and I definitely had to refer back to the old criticality just to look and see where the changes needed to go. I also had to look in the top section to review the reasons for residential, reasons for day, reasons for supports. So this is not going to be a quick process. It's going to take a little bit of time to just study each record to figure out where the services need to go in the criticality assessment. So once you're in the assessments, you're going to access the new Criticality Summary 2013. You click that link, and it's going to take you to a or an incomplete criticality assessment. And I've erased a lot of data, but what you'll see is the top section will have all the text available, and the services that you'd indicated on your previous criticality, they're going to be indicated on this as well. So Harmony was able to pull over some data from the previous criticality. And when I say the previous criticality, we are looking at the most current criticality that's set to complete or approved. So what you'll see here is the first section that has information, and you want to review that information. If anything's changed, you'll certainly want to update that information. Again, keep in mind, if you have someone that you want to put in the high-risk category, you're going to have not only the information here in the criticality assessments, right here in this section, you're going to have that backup documentation. The second section is the category section, and this is where you're going to see the incomplete areas that you'll need to complete. If you have people that were in high risk or family support, no matter what service group, you'll have to go back in and complete this information. And again, you have to bear in mind that on in Category 1, you're not going to have the ability to add day habilitation. In Category 2, family support, you're not going to have the ability to add residential habilitation. So these are the areas, Category 1, 2, and 3, that you're going to want to look at and make sure that you have completed the criticality assessment to match the existing or the old criticality assessment. Again, the medical and behavioral section, that's another section that will be automatically populated by Harmony based on your previous completed assessment. If anything's changed, make those changes. If not, then you don't have to worry about those sections. The only time to be concerned about those sections is if you don't have anything completed and you have someone in Category 3. Now, some people don't have medical or behavioral concerns, so if those are blank intentionally, then that's okay. When the case manager has completed their assessment, you're going to have to notify your case manager's supervisor manually, and by manually, however you want to do it, via email, via walking over to the desk and telling them that you've completed a list of assessments. However you work that out internally, there's not a good way right now for the system to notify the case manager supervisor that they have a pending assessment. The way that the cutover worked or the update to the new criticality worked is that Harmony copied information over into all the assessments, into new assessments for everybody waiting, and set them all to pending, and we wiped out the ranking for everybody. So the process right now allows case managers to indicate, or allows case managers to create new or updated criticality assessments, and the supervisor can go into the pending assessment queue and see what's new. The difference here is that you're going to have all 400 updated or pending assessments. So there's no way for you to know what has been updated by your case manager without the case manager giving you a list and saying, these are the people that I've completed. You can go in and look at their assessment. So what you'll see on this screen is just a snapshot of what a case manager supervisor might see. When you go into your pending assessments, you're going to see all 414 records, or however many records you have. The easiest way, I think, to search it would be by case number. You may be able to search, and I really didn't pull down these filters. You might be able to search by the worker, but I'm not sure about that. So you may just have to go in person by person to look at this information and to set it to complete. The other thing that I want everybody to remember, and I wrote another note, is that we really do need the high-risk assessment attached as a note before you send us on to the waiting list coordinator if you have someone in high-risk category. So there's a manual process that has to happen between the case manager and the case manager supervisor. There'll be a manual process that has to happen between the case manager supervisor and the waiting list coordinator. When the case manager supervisor sets a record to complete, there's no way to go back to programs to send it to the regional office because we're bypassing that step. So while you see your pending assessment queue as 414, the waiting list coordinator sees their waiting list queue as, 1,000 possibly, or 800 or 900 updated criticality assessments to look at. So we'll have to have a manual way to notify from the case manager supervisor that you have looked at these assessments and you've set them to complete, and now they're ready for the waiting list coordinator to review them and either approve the waiting list record or set it to pin or deny the waiting list record. So I don't know how you all want to coordinate that. I think that it's better to be set up and coordinated by each regional waiting list coordinator on how they want to be notified of what records are ready to be re-ranked. But as the case manager supervisor, as you're completing records, I know that the waiting list coordinators, they're going to want to know who those people are so that they can, at the same time, be reviewing the information and re-ranking people. The idea is that this is going to happen within 2 weeks, which is 10 business days, and it's going to happen simultaneously. And we can't really say that we're live with the waiting list until everybody has had an assessment and has been re-ranked. And that's why we have asked in the previous webinar to hold applications at a given time, and we'll go over that timeline again. Okay, so after the case manager supervisor, after you notify the waiting list coordinator, the waiting list coordinators will start working on approving waiting list criticalities to re-rank everybody. Again, when we go live and Harmony switches us over to the new criticality assessment, they're also going to wipe out the rank for everybody. So everybody that's ranked right now will receive a new criticality assessment and a re-ranking. The chances of someone staying in the same position on the waiting list are very, very slim. The likelihood that someone maybe in category 4 or 5 staying the same or very close is greater than someone in category 1 or 2. You're going to see some changes. Some hopefully for the positive mostly, but you might see some residential habilitation criticalities drop, especially if you've had someone in that family support for residential. I'll go over this information, the final information, and this is the conversion steps. I have not heard from Harmony that anything's changed on our timeline. This is the last webinar that we'll do prior to the implementation. The cutoff date for submitting waitlist applications using the old Criticality Summary was May 31st. The old Criticality should be retired June 7th. That's Monday. I'm sorry, that's Friday. The new Criticality assessment will be available June 10th. Reassessing of people will occur June 10th through the 21st. That's 10 business days. That's 2 weeks. The regional waiting list coordinators will review the waiting list records in that same time period. So it's simultaneous. As you get records and you set them to complete case manager supervisors, then you're going to send those over to the waiting list coordinators, and they're going to be working on approving these to get them done within those 10 days. The waitlist re-ranking should be complete June 24th, and that's the following Monday. Again, we are not going to say that we're live with the waiting list until everybody has been re-ranked. So during this time, for instance, if you had something that was pended that never got approved, basically you're going to have to go back and redo that criticality on the new version. Once everything's been, all records have been submitted, then we'll go live with the wait list. In the meantime, if you have emergencies, we're not going to know, we're not going to have the ability to rank somebody during this process. If you have emergencies that need someone to look at, send them to the director. The director will know what to do, or they'll call up to central office and we'll figure out what needs to be done if you have a true emergency. So don't sit on emergencies. Notify the regional office, and we'll try to figure out what needs to happen with the true emergencies. Otherwise, we're holding off on everything until June 7th, until the conversion. Again, we say that the timeline may be subject to change, but I have not heard that there's going to be any kind of change. We've tested the system. It seems to be working well. That's not to say there's not going to be a hiccup. If we find something that's problematic, we're taking a snapshot of what the current waiting list looks like. You know, if things just blow up, we could always revert back to how it was. But I truly think that it should go okay. It should go well. And given the time frame, hopefully we can get the waiting list back up and running within the 2 weeks that we are projecting that it'll take. So that's the end of my presentation. Again, this was the second presentation, really just reviewing the first webinar information, going over the criticality changes, and adding to it the Adidas steps and process. We will try to record this and post this on the web in case anyone wasn't able to participate in either webinar. If you have questions, please contact your waiting list coordinator or your director. If there's questions that they can't answer, then we'll try to help them up here in central office, but they are the experts. They know the most about the waiting list and the criticality, so they are definitely your first point of contact for questions. And if you don't hear anything else from us, then we're going to go live with the new criticality June 7th. And I will keep everybody posted, and you'll probably receive an email via Charlene Weldon through the listserv that we're good to go, and we'll move forward. And we'll do everything we can do to help with this process. Okay. I appreciate it, and if you have any questions, please get up with your regional office. Bye-bye.